We have an academic development of CAR T cells in our institution, and we have already a CAR T for CD19 malignancies, ARI2, ARI1, that is used as a hospital exception in Spain. And following this development, we also have some preclinical studies about in vivo and in vitro efficacy of a CAR against BCMA. That is our RE2H. We decide to give this trial to patients with at least 2 lines of treatment for multiple myeloma that were refractory to the last line of treatment and exposed to the main family of drugs. And the idea was to give 2 doses of 3 million of CAR T cells, one initially, 1 dose, and a second dose 4 months later, at least 4 months later, for patients with some degree of response and no relevant toxicity. And the idea coming from our CD19 experience was also fractionating the first dose in 3 infusions. We are very lucky that all the patients showed at least partial response. And in fact, 63 are in complete remission and 93% in very good partial response or better. And the toxicity in general is mild in terms of cytokine release syndrome. Is 90% of the patients have a cytokine release syndrome, but it's always grade 1 or 2. And we have no cases of acute neurotoxicity or late neurotoxicity. We are now recruiting a second cohort or another 30 patients, because the first study was performed in 30 patients in order to confirm the results in efficacy and safety. But we would like to have the possibility to offer our treatment to patients in Spain, and why not even in other countries in Europe, because we know there is a lack of a standard for treatment of patients when they have refractoriness, for example, to lenalidomide, to daratumumab. The options are more limited, and we think that our CAR, RE2H, is a promising therapy for these patients. I think that it's very important that we encourage researchers in Europe and in other countries for developing this kind of academic strategy for now that we are facing this new era for the treatment of patients in myeloma and other hematological malignancies with immunotherapy, such as CAR T cell. I think that is very important to reinforce the possibility to an academic development.